Alicia Coffrini showed no signs of illness as she and her friend Lizette headed for the beach on a day off. Then, without warning, the worst possible scenario unfolded.
Alicia, wake up! Alicia!
Cerebral aneurysms and arterial venous malformations, also known as AVMs, are serious and deadly medical conditions that can go undetected until a normal day is suddenly turned into a life-threatening emergency. There are very few health institutions, let alone community hospitals, that are able to handle cerebral aneurysms and AVMs. Washington Hospital's Cerebrovascular Neurosurgical Program, an integral part of the Taylor McAdam Bell Neuroscience Institute, is one of the very few programs offering leading-edge treatment for these potentially dangerous and deadly conditions. Conditions that require highly specialized expertise and the ability to act swiftly when the emergency arises. I'm John Thomas Mehigan, your host for our ongoing series, Inside Washington Hospital. Today we're going to take a closer look at the hospital's cerebrovascular neurosurgery program, the people, the procedures, and the state-of-the-art devices that give Washington the unique ability to treat cerebral aneurysms and AVMs, no matter when these conditions may strike, anywhere in the Bay Area and beyond. Alicia Coffrini's story is perhaps the best way to illustrate the best-case scenario when cerebral aneurysms and AVMs strike without warning. The physicians, nurses, and medical staff of the Cerebrovascular Neurosurgical Program play a critical role in enabling a positive outcome when an otherwise healthy person suffers an unpredictable large brain hemorrhage. But as we can see from Alicia's story, a positive outcome relies on a highly coordinated team effort that starts with the first call for help to ensure the patient gets to the right hospital in time to save his or her life.
I was off that day, I didn't have school or anything, and my friend Lizette, she has that day off as well. I really wanted to go to the beach because it was such a hot day. So we decided to go to the beach and we took our dogs and we went to the beach.
So we get in the car. Literally 2 minutes after driving, she brakes and she starts feeling pain.
I had a headache and I couldn't hear out of my left ear, which I thought was very strange.
She grabs the side of her face.
I can't even hear out of my left ear.
She's not responding. Alicia! I can tell she's barely breathing.
County Fire, Valley Ford Medical Aid, ill subject on the side of Highway 1. Respond code 3 for an ill subject on the side of Highway 1.
Control 2, Medic 811 is responding. When we got on scene and I saw our friend was there, it was pretty crucial having a friend because it's somebody that can kind of tell you what happened. And when she explained that she was complaining of left ear pain and then a headache, I immediately thought that there was a stroke or some sort of hemorrhage going on in the head. First thought was we're going to have to load and go, essentially just get her up and quickly because our closest hospital is about 20 minutes away.
The closest facility was Petaluma Valley Hospital, but they weren't equipped to handle a case like this. Washington Hospital was. Alicia was going to be transferred emergently to Washington Hospital here in Fremont, 70 miles away, and it was crucial that she be transported as quickly as possible. How does that happen? Through the help of a transfer center such as VeraHealth, an organization that specializes in the emergency transfer of critically ill patients from any location to specialized hospitals for a higher level of care.
The transfer process for a sending facility is quite simple. They call one dedicated number and our staff answers the phone and essentially from A to Z walks them through the entire transfer process, ensuring that all of the specific needs for the transfer are met.
All right, and what's going on with Alicia today?
When the request came in from Petaluma Valley Hospital to transfer Alicia and the need to transfer her to a facility that could care for her, it was our first thought to transfer her to Washington Hospital. The care that's provided for neurovascular emergency patients at Washington Hospital is really unprecedented. And that starts with Dr. Thomas and Dr. Rose and their ability to quickly determine whether or not a patient has a need that they can intervene on, and their communication with the sending physician to let them know what it is that needs to be done for the patient prior to sending them.
That information really comes from the phone call. And strange as it may seem, we don't really need to see the images from the outside hospital, at least not yet. What I need is to talk to the doctor who's looking at the patient. And the doctor tells me the patient is comatose, she had to be resuscitated in the field, she's 26 years old, and she's barely hanging on. That's all we needed to know. But that doesn't give us a sense that she will survive. I knew that just because of her age and the suddenness of the illness that we had to go full throttle here.
There are very few things that can lead to out of the blue large brain hemorrhage in an otherwise healthy young person. And ruptured AVMs or ruptured brain aneurysms are the biggest thing. And the way he described the radiologist's interpretation of their picture test, their CT scan, sounded just like that. And that's when I knew that we were the right place for us to get her to come to very soon for emergency life-saving and hopefully brain function-saving treatment.
When we come back, we'll take a closer look inside the cerebrovascular neurosurgery program. The facility, the cutting-edge equipment, the physicians, nurses, and medical staff who work so efficiently together to get the job done. There are two kinds of procedures used to treat cerebral aneurysms here at Washington Hospital's cerebrovascular neurosurgical program: microsurgical clipping and endovascular neurosurgery. Often, both procedures are performed together on the same patient. Microsurgical clipping involves a craniotomy or opening of the skull, after which an operating microscope is used at the base of the brain.
At Washington Hospital, we make use of all of the technology that exists in modern cerebrovascular neurosurgery. That includes craniotomy with clipping, or putting a titanium clip across an aneurysm to eliminate blood flow from it. It includes coil embolization, which is the surgery done inside the aneurysm without actually opening the patient's head. So these days we can make a tiny access point in the patient's leg, enter the arterial system without opening the skull, and navigate a tiny microcatheter all the way through the body, through the abdomen, through the chest, through the neck, into the patient's head, into his brain, into the aneurysm itself. And then once the microcatheter is inside the aneurysm, we can deploy platinum microcoils, one after another, until the entire aneurysm is full of platinum. And this eliminates blood flow from the inside out, as opposed to the clip, which eliminates blood flow into the aneurysm from the outside of the blood vessel, and of course necessitates opening the skull.
A brain aneurysm is an area of brain artery where there's a weak spot in the artery wall, and it leads to ballooning or an outpouching of the brain artery. And these are things that usually are there since birth, but they can grow over time. The biggest challenge with these aneurysms is that they can explode, they can rupture, and cause very high level of bleeding in the head. And there are very few places in the world where there's a surgeon that has both direct open surgical experience and techniques and all the more sort of modern endovascular, minimally invasive techniques. And using those in combination is a sort of novel approach, and we can do that at any time.
When you go in under the operating microscope, the first thing you encounter is blood. There's blood everywhere. There's blood and there's brain. The thing that bled is down deep. It's out of sight. So you have to get through the proper part of the brain and then get rid of the blood so that you can see. Then when you start to see the enemy, you surround it and you resect it entirely. And that takes many hours for an AVM.
The goal is to eliminate the flow of blood into the aneurysm so that it never ruptures again or never ruptures for the first time. And at the same time, preserving the normal blood flow in that same area. I'm a neurointensivist and a stroke expert, and so my role is to help identify what the disorder is, what the disease process is, to stabilize the patient and identify what caused the injury and how to prepare them for the surgery that they need to then definitively cure them.
I'm one of the few cerebrovascular specialists in the United States that is trained in both interventional neuroradiology and classical cerebrovascular neurosurgery. So I do open microscopic brain surgery to eliminate both of those things, AVMs and aneurysms. But I also do interventional procedures which do not require opening of the patient's skull. Which of those techniques I use to eliminate a particular AVM or aneurysm and totally depends on what is best for that particular patient. So I have the luxury and the advantage of being able to choose the very safest thing for my patient. My role in the treatment of aneurysms and AVMs is that they are my enemy, and I try to eliminate them every day.
Of course, having world-renowned physicians performing these procedures sets Washington Hospital apart. But they don't work alone. They rely on a highly skilled team who perform with an incredible level of expertise.
We work as a great team for a better recovery of our patients. We have the latest technology, and we use the evidence-based practice here for taking care of these critically ill patients. From the nurses' side, we have a great nursing team, and our nurses even have specific certifications like CCRN and CNRN.
The nurses are absolutely critical. And I would go so far as to say that the nurses are running the show. After the initial surgery, it's the nurses who are making all of those detailed observations of the patient and how the patient is doing, making sure the medications are properly administered. Their participation in the patient's recovery is absolutely essential.
Our goal is always to get the patient treated as fast but as safely as possible, and we almost always cure patients of their aneurysms within 24 hours of when they arrive to our hospital, either through our emergency department or if we fly them in with our helipad from another hospital. The vast majority of the time they're treated with only after a few hours of their arrival. And that is to really prevent that aneurysm from hurting them, from re-rupturing, from breaking again. So it's crucial to stabilize the patient immediately, get them to a center that can cure them of their aneurysm, and then doing that combination of surgical procedures as soon as possible.
We're sort of an interesting combination of old school and new school. You know, we're not some behemoth medical center that doesn't interact with its patients. We're very much in tune with our patients and their families, and we are classically trained physicians and nurses who make the best possible use of new technology.
Well, I think that Washington Hospital and Dr. Thomas and I are an excellent place to have these kind of treatments. There are very few places in the world where a patient that has an acute brain hemorrhage from an aneurysm rupture or an AVM rupture will be able to have the rapid and personal attention of a very skilled and experienced neurosurgeon that not only knows all the most modern, small, minimally invasive treatment techniques, but also all the tried and true classic open neurosurgical techniques. We work very well together as a team. And so this is one of the reasons why we think that we can treat very, very sick patients and yet have very good outcomes.
We do this every day. This is the type of surgery we do here. We are well equipped to do it, and we're completely unbiased in the methods in which we use to treat it. So we have a full array of neurointerventional and open microsurgical techniques, and we don't care which ones we use. We use them even-handedly. Sometimes we use the same 2 sets of procedures on the same patient in the same day. We just use whatever weapon we need to keep the patients safe.
After the break, we'll examine some procedures used to treat specific patients, and we'll hear what some of these patients have to say about their experience. Not every patient suffering from a cerebral aneurysm or arteriovenous malformation has to be transported from many miles away to Washington Hospital by helicopter, but nearly every case is a life and death struggle.
I was out doing some shopping, just doing errands, going from store to store. I left Orchard Supply and went to Safeway at the Fremont Hub. And when I stepped out of my car, it felt like my head exploded. It was the most searing and strong pain that I ever imagined a person could feel. After my head exploded, I sat back in my car, and I know I was unconscious for a period, but I don't know how long. And when I woke up, I was covered in sweat, and the first thing I did was check my rearview mirror to see if my face was sagging, because I did think I was having a stroke based on the pain that was in my head. And my fingers and hands and legs were moving fine, so I knew I needed to get to the hospital. So when I arrived at the hospital and went into the emergency room, and things happened quickly and efficiently, and it kind of started to calm me down because I was so afraid that I'd have to wait or that I'd be doing something that wasn't the right thing. The minute I got the gown on, the gentleman called my name through the curtain and asked if he could come in, and he had a gurney to take me to CT. And they wheeled me back to my little emergency space, and Dr. Thomas and Dr. Rose were waiting for me when I got back into that room.
When I first met Michelle, she had just arrived in the emergency room, and we had a picture test, a CAT scan of her brain taken, demonstrating the aneurysm that had ruptured and the bleeding stroke that she had. It's called a subarachnoid hemorrhage.
She had just had a subarachnoid hemorrhage, so you're talking about someone who has had a potentially lethal bleeding event in her head.
Dr. Thomas was kind of doing a history, and then I thought that I should probably mention that I have polycystic kidney disease, which is known to cause aneurysms. And it was very funny, as soon as I said that I had that, it seemed like he knew exactly what was going on and how we would progress. They took me back to CT. Again, I was the first one there. They administered the contrast and did the second CT, went back to the room where Dr. Thomas and Dr. Rose were still waiting.
So she's sick. She had a sudden onset of very intense, incapacitating headache. And there she is sitting on a gurney in the emergency room, still talking.
The thing that was so amazing is that there was no time spent waiting, because I was afraid about time. I thought my head was exploding. And Dr. Thomas had drawn some drawings, actually, to show me what was going on. And they explained to me that I would have to have surgery. I know that I received the best care I ever could. I mean, I and my family think that they are the two best neuro people that could exist. Their energy, it was very serious, but it was calm. I was jacked up by what was going on. They were calm, and that's the way that needed to be.
How are you?
Good.
So even though Michelle had a life-threatening and severe brain hemorrhage, we were able to treat her rapidly, effectively, and get her through the next critical phase of her care. She's recovered fully, 100% recovered, and if you met her now, you would not know that she's had open brain surgery.
She's beautiful and smart, just as she should be. And all of that is behind her now.
I am a miracle, and that I'm not just saying that, it's really true. The fact that my aneurysm was found and treated so quickly, it is a miracle. And I know it's because of the care that I received that I'm here. I don't disregard that, and I don't think differently ever. I know it's because of the care that I received.
Hey, how are you doing?
Hi.
Good to see you.
Alicia is doing tremendously well. If you looked at her, you would hardly even know she had brain surgery. She's doing that well. The thing that she had that almost killed her has been surgically cured. It's never going to be a problem for her again. And she has really no restrictions or limitations at this point going forward. And we're just so happy to be able to have provided that for her.
I would say to Dr. Rose and Dr. Thomas, just thank you. They saved my life, and they did an amazing job. Every day now I live life differently just because I am so thankful, every single day I'm thankful that I'm alive, that I'm here, that I literally have the best people in my life. I have the best family, I have the best friends, the best boyfriend. So I think that's the biggest change for me, is that I'm just thankful, and I never take anything for granted anymore.